Thank you for attending the Business Recovery and Sustainability webinar series through the St. Louis Regional Chamber. This webinar is focused on reopening the region. My name is Tabitha Saris, and I am the Vice President of Investor Relations at the St. Louis Regional Chamber. My co-moderator is Bethany Monahan, our Director of Business Engagement and Membership at the Chamber. A few housekeeping items before we begin. Everyone is automatically muted. We encourage you to ask questions throughout the webinar, but please submit them via chat and Bethany will read those at the end for our panelists to answer. A recording of this presentation will be available after the webinar is complete. However, before we get started, we want to give two big shout outs and thank yous to our amazing sponsors, technology partners, and Kitty Academy, who is serving St. Louis healthcare and essential businesses in this time of crisis. We appreciate you. So let's get started and meet our amazing panelists. We are going to let them introduce themselves, and let's start with Amanda. Amanda, you're muted. There you go.
Thank you. Hi, I'm Amanda Gonzales. I'm the community manager here in St. Louis's first WeWork. I was recruited to open the WeWork here last August. My partner is originally from St. Louis, so it was a privilege to be able to come home, or him to come home, and now it's my home. I live in the Central West End, really just loved the warmth of St. Louis community, and well, while in quarantine, especially it's been interesting living in the Central West End and in a high-rise building, been really into painting again and long walks in Forest Park. So really excited to be here and share our learnings with you all.
Thank you, Amanda. All right, we're going to go to Dr. Pogue.
Hi, good morning, everyone. Doug Pogue. I'm an internal medicine physician and came to WashU in the early 90s. Left for a time and then came back and set up a long-term internal medicine practice at Missouri Baptist in 1999, and I've been here ever since. I signed on to a fledgling team to be their team doctor, the St. Louis Rams. So I had some time in the NFL through some crazy times and some good times for St. Louis in terms of NFL football. And then now I have the privilege of leading my medical group, which is about 600 physicians and about 2,000 people overall for BJC. So we've been focusing on the creation of value for people in the market and for our patients, and decreasing the cost of healthcare. And of course, for the last 3 months, we've been figuring out how in the world do we retool to make medical offices and hospitals safer for folks to decrease the spread of COVID, and how do we treat people well and keep our staff safe. So there's a lot going on. Very happy to be here and happy to share what we know. Hopefully that will be useful for all of you as you reopen your businesses and try to set yourself up.
Thank you. We're so excited to have you on. And Len, I'm going to jump to you.
Thank you, Tabitha. My name's Len Toenjes. I'm President of Associate General Contractors of Missouri. We represent about 530 commercial construction contractors across the state of Missouri, doing both vertical work and horizontal work. I'm a native St. Louisan. I've never lived anywhere else. In fact, I've never lived outside the 270 Beltway. So it's a great town, and I appreciate the opportunity to participate today. I think what's unique about a perspective that AGC brings to this is that construction, thankfully, was and is an essential occupation. And so we have been working to guide work with our contractors, work with the labor unions, work with the buyers of construction, work with the various governmental agencies and permitting agencies to steer through all the changes that we've gone through in the last couple of months.
We appreciate you taking the time to join us. And last but not least, Eric.
Yeah, good morning. Thanks for having me today. Eric Schreimann, CEO of Club Fitness, been part of the Club Fitness family for a little over 5 years. I currently operate over 20 health club facilities in the St. Louis metro market, over 900 employees, and over 135,000 members as well. What makes Club Fitness unique is we are actually a 100% employee-owned health club. We're the only 100% employee-owned health club in the country, as a matter of fact. So that really separates us from the pack. So when you visit a Club Fitness and you walk in and that front desk associate greets you, or that manager introduces themselves, they're not only an employee, but they're an employee owner as well. And so our focus has really been lifting our community, lifting our members, and lifting our employees. So excited to be here and share.
Thank you, thank you. Thank you to everyone for spending your morning on our webinar. Please remember, for all those listening, please remember to submit any questions through the chat, and we'll try to answer them at the end of the conversation. So let's jump in to the phases of returning to work. We had a substantial amount of questions submitted during registration on what it's going to look like or feel like when returning to an office space. Whether it's a co-working space or a traditional office space, it's safe to say that there are going to be some differences. As companies begin to bring their workforce back together, and calculations are being made to ensure the health and safety of the employees. Amanda, I'm going to start with you. Some changes we've heard are there are going to be wider corridors, one-way foot traffic, better air filtration, internal video conferencing, and touchless pads to access floors or other office spaces. Can you share what WeWork is doing in this space to ensure the safety of your tenants?
Yeah, great question. So I'd like to paint a broader picture, if I could, just for a moment. So WeWork, if you don't know, we're a global co-working space company with over 800 locations worldwide. And this actually includes over 100 locations in China. So we've been responding to COVID since the onset of the outbreak in January, and have been really using our learnings to adapt ever since. So while distancing may be a part of our new normal, collaboration and connection remain more important than ever. And having a safe space to do that is essential. So our goal with our members is to really encourage behavioral cooperation through good design and a unified approach across all touch points. So we're also utilizing this user-friendly signage and wayfinding to guide our members to take on this responsibility that we all have to make sure everyone feels safe and comfortable returning to the office space. And I think I can, safely say that pent-up demand for human connection goes beyond WeWork. So wherever you're at, whatever workplace you're at, we all have that need and desire, especially after, months of quarantine. So how we're approaching this is really rooted in easing the transition for our members to come back to the workplace, not only to keep people safe, but to actually have them buy into this is comfortable and they feel confident in returning to the office space. I think the main way businesses can do that is focus their resources on an evidence and science-based approach to instill that confidence for employees to return to the workspace. And so that's like high level of how WeWork has been approaching it, and what we've done in terms of concrete examples. We're looking to help companies who are members in a WeWork around the globe and here in St. Louis to reintroduce their employees to the workspace. We're thinking about, what is social distancing look like inside the workplace, and we're actually calling it professional distancing. I don't know if you've heard that term yet, but we're doing this really in 3 ways. Prioritizing personal space, implementing behavioral signage, and increasing sanitization. And so I don't know if anybody has been into a WeWork or a co-working space, but you usually see a common area, much like I'm sitting in right now, with soft seating, lounges, and what we're doing is implementing staggered seating, reducing seating capacity in conference rooms, and then, putting up buffer zones, much like you see at a local grocery store or even like at Ted Drew's. I don't know if anybody's been to Ted Drew's, but they have a really incredible system going on where they're buffering. And I heard several people say last night how it was way better than standing all in front of Ted Drew's. I don't know. I just went to Ted Drew's for the first time last night and it was incredible. But, that's how we're kind of looking at returning to the workspace and really trying to get buy-in from our members to make them feel comfortable whenever they're ready to come back.
Great answer. Okay, on that same note, I want to talk about other components of the office space. There are elevators to consider, shared spaces, which you just alluded to, and then one recent article said that we may even see plexiglass barriers between bathroom sinks. So I want to jump to Eric on this one, since you have a slightly different space that you are in charge of. So what does the fitness industry look like? Can you share some examples of what people may see when they come into the fitness space, or what the employees may experience when they come back?
Sure. Well, you know, I've been fortunate to have had the opportunity to collaborate with a lot of gym owners here in the St. Louis region, as well as really all over the country, to come together and put some strategies and procedures in place to ensure that we're doing all we can to ensure the safety of our members and our employees. You know, so it's business, but not business as usual. There will be some changes that take place in our facilities. First and foremost, capacity. You know, we're really ensuring that we're maintaining social distancing in our clubs, and the only way to really do that is to spread out or eliminate some equipment as well. We've always focused on, the last several years, we've really focused on cleaning protocol and procedures, but we've absolutely stepped up our game and really had to invest time, effort, and money into technology, as well as different type of cleaning products and supplies as well. Utilization of hydrostatic cleaning guns. We're utilizing ultraviolet cleaning tools as well. You touched on, elevators and buttons. We've got what's called nanoseptic disinfecting wraps on all of our doors and things that people touch on a regular basis, as really, and stepping up our overall cleaning protocol and procedure. My advice would be, if you don't have a structured cleaning protocol and procedure in place, you need to get one as well as ensuring that all of our employees are trained and up to speed on how to effectively clean a piece of equipment. And this goes not only for a health club, it can go for really an office or a WeWork or any industry. What are we using to ensure that we're cleaning the surfaces of our work areas effectively, to help, again, ensure that we're maintaining a safe environment for our members and our employees. So there'll be reduced equipment. We will have a capacity as well. So at times there may be some members that have to wait outside, kind of the one in, one out. But again, we're going to do everything that we can and err on the side of caution to ensure that we're doing everything we can to mitigate and ensure that we're maintaining safety for our members and our staff.
Very good. I, for one, am looking forward to getting back into the gym. So, Dr. Pogue, we had a few questions around the medical industry and how it will separate services to isolate COVID healthcare needs versus other healthcare needs, including like elective surgery. What are your, how's the hospital separating those two? And then do you foresee any permanent changes for the future?
Yeah, I think there's going to be actually a whole number of permanent changes that you'll see in hospitals in particular. So a few things. One is that from a elective procedure standpoint, it's critical that this healthy person who's coming in to get an elective procedure stays healthy and doesn't pick something up while they're in a hospital facility or a rehab facility in their recovery. And so we test everyone, honestly, before they come in for an elective procedure. And just for everyone's edification, what we're finding, so these are people who need a surgery, typically a joint replacement or some other kind of elective surgery. They feel fine. The physicians and other people who've checked them out think they're fine, and we test them anyway. So it's one way of testing the prevalence of who's actually asymptomatic for COVID out there in the St. Louis area. Right now, that rate that we're seeing at the major hospitals around town is less than 0.5%, and increasingly it's almost 1/4 of 1%. So there are some people, somewhere 1 out of 300 to 1 out of 400 people that are walking around who really think they're fine, they feel fine, but they actually have COVID and have the potential to spread it to someone else. So it's out there. It's not a lot of people, but it's out there. So we test everybody, and then we've redesigned kind of the check-in process and how people even enter and exit a building, such that everything is touchless. So all the doors have been refitted with ways for them to open electronically with motion sensors, so people aren't touching door handles and actually sharing those kind of touch services. Our check-in process has gone completely electronic. So we're not having pens and paper or other kinds of things at our front desk that people have to use again on a repetitive basis that we would either have to be cleaning or have be one use only. We're trying to increase that. I think what you're going to find on the permanent redesign side is waiting rooms will start to evaporate or become much, much smaller than they ever were. Kind of the old classic hospital situation, or even a doctor's office situation, of a lot of people sitting in a waiting room, waiting to be seen or waiting for their time for a test to be done or something like that. You know, that's just an area that's people are very vulnerable to being exposed to whatever anybody else in the room happens to have. And so we've gone to almost a no waiting room process where so for instance, on the outpatient side, we check people in electronically from their car and send them a text when their exam room is ready, and they literally walk right in the door of the doctor's office, say, "Hey, I'm Doug, and you guys just sent me a text," and we send them back directly to their exam room. So they move, you know, from outside the facility directly into their personal room with clean space, and then when they exit, they do the same thing. There's no lines at the front desk or any of those kind of things in which people would be in close contact to each other and could spread. So I think you will see some structural changes to do that. You can also argue that hospitals in general have always been a bit paranoid about cleaning. You know, we tend to be very aggressive about cleaning in a hospital anyway. But it's really the process flow. How do we avoid crowds of people together? I think that is the big change for hospitals. And if you happen to need a hospital or be in one anytime soon, you'll notice that that's a fundamental change. You move essentially directly to wherever it is, the area that someone's going to care for you, and there's no waiting around or standing in groups or those kinds of things.
It sounds like it's going to be a lot more efficient than
actually. Yeah, there's some benefits. Who wants to sit in a waiting room anyway? So there's some good things coming out of it.
Love it. I'm going to stay with you because we had a few questions around testing. And how do you foresee companies providing testing for their employees? And how often do you think it should occur?
Yeah, I would save your money. Let me walk through a couple of different kinds of testing and where I think it can be used. But I think there's too much of a focus on companies doing their own testing right now. So let me start with the newest thing on the block, which is the antibody type test, something we call an IgG test. Or you may see it as a serology test is another name you might see. But essentially is a blood test on someone who feels fine, but they want to find out if they had COVID. Maybe they were sick back in February, March, January, something like that. They're wondering if they had COVID. And if, for instance, if the test says, yes, actually you were exposed to COVID and it looks like you got over it, do I have to mask? Do I have to take all these precautions? Can I do some things differently because I've got this test? The tests that are out there are actually not good enough to give you a reliable answer as an individual person. So if I get one of those tests and my test is negative, I say, okay, well, I need to wear a mask, I need to take precautions, I've got to keep my distance, all those kinds of things, right? If you have a positive test, right now, it's actually more likely that it is a false positive test than a true positive test. And even if you have a true positive test, we don't know yet for sure if you've had antibodies, whether or not that is truly protective of you as a person from getting it a second time and getting it again, or if not, or you may be able to get COVID twice. We don't know yet. We just haven't had enough experience yet. So literally, a negative test, you've got to take all the precautions. A positive test, you still have to take all the precautions. So don't waste your money. Don't test your employees with antibody tests because it's not going to actually help you change anything, either in your corporate behavior or in people's individual behavior that they have to do. The second thing is I think that from a company testing standpoint, what you really want to do, you can do the kinds of screenings we do for surgery. But as I told you, the rate of asymptomatic people coming into your office, if your employee pool is like the kind of the average in St. Louis right now, you're only going to get a positive test for about 400 tests that you do. And really at that point, you're more cost effective to actually take precautions to keep people from transferring things to each other, rather than trying to test everyone to screen them out. So for instance, personal masking is essential. So right now in community spaces, you're going to have a personal mask on. How we do it, knowing what we know from a healthcare industry standpoint in our business offices, is that if you're in a personal office, and I'm in a personal office right now, locked off space, it's just me, I can take my mask off and have my mask off. Any public hallway, anything that I'm together with people in a conference room or anything like that, everybody's mask on, whether you feel fine or not. If you're sick, you don't come to work. And when you do come to work, it's mask on the way in. We take a temperature on everybody. We do a short screening where we actually have a simple app, and they're available free on the internet. Answer a few questions to make sure you've had no exposures, you have no loss of taste, smell, fever, sickness, upper respiratory symptoms, and those kinds of things. We take a temperature on every single person that comes in. We do that with a thermometer that is infrared, and so there's no actual supplies to buy or to consume. As time goes by, you can use that thermometer as long as you can charge it and have a battery. So you can be very cost efficient in terms of your ability to screen all your employees every day as they come into work. Keep them from infecting each other by wearing a mask when they're in common spaces, and then have some rules such that the chance that you're going to actually asymptomatically infect part of your employed population is very low. That's really where you're going to get the most impact for the money that you spend. If there are companies that really do want to do all of the tests and maybe screen or test on a regular basis, you can do that. But just as a caution, you're going to spend a lot of money and get very few positive results. And for what we know, if you do the masking and other kinds of procedures, you'll still prevent infection in your employees and can actually do just as well by spending a lot less cash.
Great advice. Absolutely great advice. All right, Len, I'm going to transition to you because we had some questions about contracted employees, and I know the AGC has contracted employees who visit multiple sites. How are you navigating the placement of your contractors at this time? Are you putting any safety precautions in place outside of the recommended CDC?
There are really a lot of multiple layers when it comes to construction, because obviously it's not an office environment which is relatively static. It's a very dynamic situation. You have different people on the job site every day. You have different subcontractors, different craft workers, different supplies being delivered, different changing work site conditions. So there are a lot of layers that the contractors need to take into consideration as they move around. Certainly there's the CDC guidelines. OSHA has some guidelines that they are promulgating for the workspaces. Every owner that I work for, if I'm working for a health club, is going to be a lot different than if I'm building a gasoline station, than if I'm building a school, than if I'm digging a trench for a sewer. A lot of different worksite conditions. Every municipality that I go to, every county that I go to, there are at least 5 or 6 different layers that the contractors need to take into consideration. So as a trade association, that's been one of our biggest challenges, is to stay current with what's happening. What phase is this county in? What phase is that county in? What does this owner want? What does that owner want? So it's really, I think, for our companies, been a case of staying nimble and being able to respond to all those changing environments. Some require the gunning, the temperature testing. Some don't. We're actually entering time of the year right now when heat gets to be concerned, and the balance between wearing a face mask and making myself more susceptible to heat exhaustion gets to be an issue. So there's a lot of balancing acts that need to take place, and there's no hard and fast rules right now. It's just a case of staying cognizant of the environment you're in.
Okay, great. And we have some questions in the chat, which we will get to shortly, but they go along with what you're asking. All or what you're speaking to, excuse me. Let's go. We had a few questions about job seeking, those who we all talk about, our current employees, but what about those people who are currently looking for employment? I'm going to start with Amanda, but and then we'll just go down the line. Do you have any recommendations for what current job seekers should do for networking opportunities?
Yeah, honestly, I think there's so many resources online, more now than ever. For WeWork at this point, we're hiring, but it's not business as usual where we would, have the candidate come into the space, visit the space, interact with my employees. Everything is online, everything is virtual. And so I think that that's your number one resource, is just hitting the laptop.
All right. Len or Dr. Pogue or Eric? I think Eric's yelling at somebody.
I think as far as networking goes in our world, we're statewide. So some areas of the state are different than others. But I think, as was said, meetings like this, events like this, a lot more social networking is the way that people have been surviving this. We've had even our committee work and things like that are all going to this platform. So it's case by case. Best answer.
Our recruiting platforms are still vigorous, and I think the part of the key is that it's now socially acceptable everywhere to do a Zoom meeting like we're doing right now. And so as people are trying to bring on new employees and do other kinds of things and network, it may have been considered a little odd to do it this way, 6 months ago, but now everybody I think has accepted it. So whether it's networking events or other kinds of things that we're doing, or just trying to hire a new employee and doing all of the interviews over Zoom and other kinds of things, people accept it now. So we found it's been okay, and both the prospective employees and from our side, there's some nuances you miss not being in person with someone, but by and large, people are accepting that this is the way we've got to do it for now.
Yeah, very similar for us as well. Fortunately in our industry, a lot of our employees that we find are members as well. So they have the opportunity to come in and interact with the staff here, and we follow the same protocol, Zoom, interviews as well. So we're status quo, with the exception of we're not doing any in-person interviews yet at this time.
Let me just jump back in there for a second, Tabitha. One of the challenges is with the schools being closed and the educational institutions not having availability there. That's obviously an important resource for us, and that's put a little bit of a crimp in our style.
Does anyone have any recommendations on the people who don't have access to online resources?
I think most people have a smartphone, and I think, I'm just assuming here, most people have a smartphone. I don't know if and it's like basically a computer in your hand. I know that there's so many applications that you can download. LinkedIn is one of them. There's so many places in St. Louis right now that are hiring. I totally want to acknowledge that unemployment is at an all-time high, and I think what we feel really lucky about in St. Louis is there are so many local companies that are hiring, that have a need right now to fulfill. So I would say utilize that. I think companies are also now more empathetic and understanding more now than ever to the fact that some people don't have the broadband internet, don't have access to a computer. And while libraries and other local resources are closed due to COVID-19, I think that's the best way is to utilize the resources that you do have, and companies are really understanding to that.
Yeah, people need to be reminded, I think, that the landlines still work. So you still can pick up the phone and talk to somebody. And again, it's maybe not as good as seeing their face and all that kind of stuff, but it's what you have, it's what you have. And I think people are adapting.
Okay, let's move to sanitation and safety. And Eric, we had a ton of questions as it relates to the gym. And I know there were some in the chat that you answered as well. But have you considered placing a monitor in your facilities? I know for pools, and there's some questions on pools too. If pools reopening, some pools are required to have a lifeguard and a COVID monitor to ensure that everyone is being compliant. Can you talk about some of the things at the gym? How are you ensuring that people are following the right procedures?
Yeah, great question. So, we are putting those efforts in place. When our members come in to our facilities, first off, it's a touchless check-in as well, and they will be diverted to a screening station where we will have an employee or two screening those members, asking them the array of questions to ensure that they're not exhibiting any signs. And then we will, starting out, be taking the temperatures of our members as well. So utilizing infrared thermometers, so they will be screened with questions, as well as temperatures will be taken as well before they're able to enter the facility. And of course, throughout the facility, we have signs and reminders on social distancing and cleaning the facilities as well. So we will absolutely have, we will have an individual employee at check-in as well. And then we'll also have at least one or two individual employees that will be used as screeners to ensure that those members that are coming in, are safe.
Thank you. And as a reminder to everyone listening, can someone from our panel please answer what is the temperature that you should stay home if you're taking your own temperature? What is the recommended threshold? And then as a follow-up to that, if you have a reusable mask, how often should you be cleaning and sanitizing your mask?
Yeah, I'm happy to take that one. So there's a couple things that we use about 99.1, 99.2 as our cutoff. It's important if you use a thermal thermometer that is going to scan your forehead. It's important to understand that can be affected by a hot car or some temperatures outside. So if I come in from the parking lot, maybe I've been driving in my car for 45 minutes and my air conditioning is broken or something like that, and someone does a thermal thermometer on my head, it is definitely affected much more by the outside air that I've recently been exposed to than if I had a temperature thermometer in my mouth. So just be aware of that as you have hard cutoffs of what the situation is. So for instance, I think about our construction workers. Construction worker in the hot sun in the middle of the day, if somebody goes and screens and uses an infrared, they may very well be high, and there may be some differences you have to do in that kind of work site than if it's just an air-conditioned office where everyone's pretty much at normal room temperature. On the masks, unless you are in a high density virus environment, so really unless you work in healthcare or an environment where you're personally taking care of someone who does have active COVID and is coughing their head off and all those kinds of things, masks really are not going to be soiled by kind of random virus particles coming through the air. They're more soiled, honestly, from your own breath and from moisture that develops over time. So wash them once a week or wash them more often than that if it's just to keep them fresh. It's one of the reasons why the recommendations now are cloth masks. So it's cheap and easy for folks at home to be able to have 4 or 5 of these things, wash them as they need to, and have them last for months. The mask that I use in my business situations, I've been using for honestly several weeks now, and it's fine. If I go into the hospital, I have a different grade of mask that I wear and a different kind of schedule in which I turn it over just because I'm in a high density environment. But for normal office work and other kinds of community situations, cloth mask, washing it once a week is fine unless you feel like washing it more often to keep it fresh just from your own breath.
Very good. Let's talk about risk. And I'm going to start this one with Amanda, because I saw a question in the chat. Are you offering surveys to any of your current tenants or future tenants to gather their insights on their thoughts and feelings about working in a shared space?
Yeah, we do have surveys that go out at every so often cadence, and members are welcome to give their feedback whenever they choose. I mean, I know I have a personal relationship with all of our members. I know all of them by name. I'm constantly checking in with them. we don't police member offices and how they interact within their own private spaces, but always welcome to feedback and in constant communication with them regarding, you know, when they feel comfortable to return to the office.
So great segue into my next question. The most asked question that we received during registration, we received 57 questions, and this topped the majority of them. Do any of you, and I'm going to start with you, Len, but do any of you anticipate that working from home will be part of the new normal in business culture?
I would say it's going to increase. Certainly, I can see it increasing. And obviously, in the construction world, no, that's something that can't be done from home. But I do see a significant number of our contractors sort of allocating it on a task-by-task basis. If I'm a construction estimator, I was talking to one of our members yesterday and said the estimators were trying to work from home, but they needed to get in the same space to look at a project and collaborate to come up with what a bid would be. Accounting staff, they can probably work from home. But I would say it's going to increase, but in our industry, maybe it'll increase by 10%. I don't see it being a runaway movement in the construction world.
All right. Does anyone else want to contribute to the work from home? No?
Yeah, I would say that, yes, I would say, you know, looking at St. Louis's, you know, where Square was founded, right? Square just announced that all their employees can work from home regardless of role indefinitely. And I think as it pertains to roles like customer service, anything that you can do on a computer, anything that you can do over the phone, I think that companies are starting to realize that over the last 4 months, they have seen their employees' productivity stay the same or even rise in working from home. And I think that just has instilled in them that they can do the work, and there is no real reason to need to come into the office. I think that people want to come into the office for various numbers of reasons. And I think in regards to those types of roles, I think we're going to see a shift moving forward.
And we've had kind of the same experience. It's job role by job role, but even when some of the functions work fine from home, we have folks that really would rather be together. And I'll take as an example, care managers, nurse care managers, who are usually bright, energetic, kind-hearted people that have conversations on the phone with patients and check on them and take care of things with them long term. They love coming to work with all the other care managers and having this office environment that is vibrant and social, and it's kind of where they connect during the day, and they've got good friendships there, and they're missing it bad. We've had to do tons of virtual happy hours and other kinds of things to connect people because they can technically get their job done just fine at home. It's a phone call type job. But they come to work for a lot of other reasons other than the job, and that's one group, interestingly enough, that even though they can do it just fine from home, they're really desperate to come back to the building because they love the environment of what they have every day. And so we're trying to sort that out job title by job title as to what makes sense, and you want to keep people safe at the same time. If most of your work satisfaction comes from these interactions, we may have trouble at some point filling those job roles if we can't provide some of those other perks and aspects that people really are looking for. So it's very much an active discussion as to how we're going to do this one.
I think you're right, Dr. Pogue, and I think that as companies make those decisions and give employees the option to work from home, I think it makes it easier for them to say, yes, I want to come in, I want to connect with people, I want to connect with my peers and my colleagues and have that social interaction. And then it actually makes things easier when, my child is sick, is home from school, I can work still productively from home while not taking a sick day, right? I think it's just, we're on the edge of work is changing, and work life is changing, and it's exciting to be adaptable and to see, what happens next.
Agreed, Amanda. And that also keeps the culture alive within the company, as you can, and the engagement if you're having happy hours, like Dr. Pogue's care team is. So our next big question within registration was event and travel-based questions. So let's jump into those for a quick minute. And Dr. Pogue, you had a lot of comments around this, but some of the questions that I have are, when do you think it will be safe to travel outside of the country?
That's a challenging question. I can tell you from our business standpoint, knowing what we know from inside healthcare, we've canceled all business travel for the rest of the year and are just clean the slate and are taking a wait and see approach to see if there's a point in time in which we feel it is safe enough to restart either domestic or international travel. It's important to note that while some areas in China, or even if you look domestically, New York and Seattle, the case rates have come way down from what they were, and there appears to be some control coming into place of the spread of the virus. The virus is continuing to spread in large scale in other countries, and some countries are just now getting started with their COVID waves. And so it's definitely moving around the globe. I mean, your Brazil is now #2, and there's other countries that are rapidly increasing their caseloads. So I think if you're going to travel at all, you need to understand the case rates of the areas of the people who will be on that plane with you, and of course where you're going. Understand the countries and where they are right now, because our experience in St. Louis doesn't even necessarily mirror the experience elsewhere in the United States, let alone internationally. So I definitely would look for items like a consistently declining case rate, number of new cases diagnosed every day in the place that you're going. Is that consistently declining? Is it objectively less than 20 cases per day in the area that you will be immediately in? And is there evidence that there's reasonable support and precautions that, again, that location has taken to ensure your safety? Planes are tough. We've already had some outbreaks on planes, and just not sitting in the middle seat isn't quite enough. So definitely, if you are going to travel, bring your masks and really take good precautions with your hands and everything else, because it's very challenging to navigate airports and airplanes without touching enough surfaces or breathing enough communal air that you can catch something.
So, okay, so then to keep on the pace of time, let's transition to plans for businesses. Is the proposed, in your opinion, and Eric, I'm going to start with you, is the proposed phased reopening based on the COVID rates of the region? And do you think that if people do what they're supposed to do, we could possibly open a little faster than anticipated?
Well, I would hope so, obviously, but I think everyone would agree that we need to err on the side of caution as well. And as quickly as I want to get up to speed and get back at capacity, I would rather take this in a methodical, slow fashion, just to ensure that, there's not a spike again in the near future, and that we're doing everything that we can to, mitigate this situation. So it's hard to say, we're at the mercy of the state government and local government as well as what we can and can't do. But at the same time, we're doing things in addition to what those county guidelines are to maintain, a safe environment as well. So I really will lean on the experts like Dr. Pogue to really provide some guidance on what is going to be the best for really the members and the employees.
Did you want to add anything to that, Dr. Pogue, or you want me to go on to the next?
No, I think that's well said. We do need to take it slow. We so far the case rate is gradually going down overall. It does have some fits and starts, that you'll see the curves if you look at them, they'll kind of go up and then go up and then, but the whole line so far is still coming down. So we'll have to see kind of how this happens in terms of the number of cases in the St. Louis area. We know that right now St. Louis County is gradually declining, but other areas in Missouri, for instance, are going up. After Memorial Day, there were some increases in the case rates. Whether that's from Lake of the Ozarks or not, we don't know. But certainly as people are getting out and mixing again, we are seeing some bumps in certain isolated places. So a slow and steady approach, I think, is wise for any business in terms of how to do this.
And Tabitha, one of it hasn't been mentioned here this previously, but one of the things that we've been working to inform our members or remind our members of is to communicate, over communicate with the employees about their own personal responsibility. And we can put all the rules in place in the world, and the mayor and the county executive and the governor, but the personal responsibility is critical in this whole thing. And that's the message we've been trying to send to our members, to drill that into their folks every day.
That's a great point. We had someone submit a question this morning that said that there is a visible lack of people wearing masks. And to the people listening, what guidelines would you recommend to them about wearing masks in public? Amanda, do you want to kick us off?
I'm not a doctor, so I just want to say from personal experience, I wear a mask in public. I wear a mask to work. I'm not wearing a mask right now during this webinar. No one's around me, but it is a requirement for my employees to wear a mask when they come to work. And if we can just all acknowledge that wearing masks that are not fun, they are uncomfortable, they are hot, they are all of those things, and we're all in that together. And it's really a community responsibility to make sure that we're looking out for our fellow human. That's all I'll say about wearing masks.
That's well said. Remember that when you're outside, particularly you're outside on a windy day, it's very hard to transmit this virus or any virus when you've got large open air spaces and air movement like wind. So if you are, kind of by yourself in the park or on the sidewalk in your neighborhood, you don't necessarily have to wear a mask, because the chance that you're going to give it to somebody, even if you are asymptomatic but in the shedding period where you could spread it, it's very difficult to spread it outside in open air. In closed air, it is very easy to spread. So, when you're in the store in any kind of closed air spaces, please wear your mask. It protects you, it protects everybody else around you. And that is one way we can help each other inside.
All right, last question before we jump into some chat questions on lessons learned from the first wave. Should we have a second wave later this year, what are one or two nuggets that you would recommend for businesses to put in place, or any lessons learned that we can implement later this year to have a quicker turnaround? Eric, I'm going to start with you, and then I'm going to go to Len, Dr. Pogue, and then Amanda.
Sure. So, one of our biggest lessons is, we have over 900 employees. A lot of those employees are part-time as well. So the ability to communicate with those employees effectively while they're in a furlough status, we found was challenging, because we didn't have all of their updated contact information, nor did all of our employees fully understand how to utilize their payroll portal to be able to communicate with us as well. So the communication piece was the biggest lesson that we learned, just to ensure we had updated contact information for all 950 of our employees, as well as they have the ability, and we can educate them on how to utilize that portal so that we can communicate effectively. So the communication piece was the biggest lesson that we learned.
Len?
Yeah, Tabitha, since I mentioned it, I echo what Eric said and echo what I said earlier. That was one big message, was communication. The second big message as a trade association, and probably for any business, is adaptability. You better put your adaptability and nimble factor on 10. You better be as adaptable and figure that we don't always do it this way. That we've got to be ready to change our communication models, our revenue models. We've updated budgets. We've looked at staff assignments. There's all sorts of adaptability and nimbleness that you have to be ready to go for. And I think that's a key lesson.
All right, Dr. Pogue, any nuggets of information?
Yeah, I think one of the most applicable, widely applicable things that we learned is that we were changing from trying to hide from the virus to figuring out how do we operate our business long term with the virus. We're basically assuming that COVID will not go away for a long time and it'll be circulating in our community for a long time. And so rather than saying we're gonna do some processes or some changes because of COVID or coronavirus, and then we're going to kind of go back to the way we used to do it once that's over. We're not looking at this as a defined time period, but figuring out how do we fundamentally operate our business with coronavirus so that if there is a second wave, a third wave, a fourth wave, we essentially don't shut down. We don't have this thing where we have to shut our business or do some other things, but we literally can continue to operate, continue to get business done with coronavirus, but keeping in the context of keeping our patients safe, our customers safe, and our employees safe. So as we're redesigning for the long haul. We're not putting in short-term, duct tape fixes. And I think that's the biggest thing that I think other businesses may want to try to do, because none of our businesses, no matter who's on the call here, can really sustain, 2-month drops in their revenue and productivity and those kinds of things. So we're going to have to figure out how to learn how to operate with the virus present and not have it be something that shuts us down if it happens to spike.
Well said.
Yeah,
Amanda?
I think that we've been fortunate, to learn everything through this first round, this first wave of COVID-19, solely based on our locations in China. Having reopened in mid-March, we spent all of April learning from that experience and from our members around the world, really leaning into our industry leaders, our partners in health and safety and cleaning and construction to really redesign what the future of workplace looks like, specifically at WeWork. And then, obviously being an industry leader in that space, how we can share that further. I think as we try to open up businesses and try to live with the virus, focusing resources on evidence-based and science-based approach is what we have to do as a company. It's our responsibility to do as a company to make sure our members feel safe and employees feel confident in coming back to the workplace.
Wonderful. All right, I'm going to flip it to Bethany. I think there was 2 or 3 questions in the chat before we wrap up.
Right. A lot of the questions we hit on, but there are 3 I think we could either circle back to or address again. So one of them was talking about how construction sites are requiring negative tests to allow different people to be on site. So is this necessary to require those negative results?
I'd say they're, I don't know that they're necessary. Maybe a better question for a doctor, but I think because a lot of this has to do with owner requirement. OSHA is not requiring it. CDC is not requiring it. Those may be business decisions that either a particular owner or a particular contractor are making. And there again, am I building an office building or am I setting guardrail on the side of the highway? Job site conditions are so variable. There's no hard and fast rule.
Yeah, I would really support that. The job site really defines what the testing and protection should be. So if you've got 4 or 5 people who are working outside installing that guardrail on the side of a highway, the chance of them spreading it to each other is actually very low. And if you add in even simple cloth or basic masks while they're doing that job, the chance of transmission is extremely low. So you wouldn't necessarily need it. Where you would want testing is in areas in which you feel like you're in a work situation where you either can't wear masks or people are spending lots of time in a closed airspace together. So for instance, if you have 10 or 12 workers who are working together underground, digging a new tunnel or working on some underground type of project in which there's dead airspace, they're all together. And in particular, if they're in a situation in which they either can't wear masks or are wearing a particulate mask or something that really doesn't do much of anything to control the breath, then you might want to test in those circumstances because it's high risk. So be very individually specific as to whether or not it makes sense to test, or if it just makes more sense, honestly, particularly economically and even scientifically, to just have everybody pop on the cloth masks and not worry about the expense of testing.
Dr. Pogue, can I ask, can we answer Ms. Peggy's question? I think she's asked several times, but when in our space, if folks don't want to wear a face mask, like a cloth face mask that covers their face, I've seen a couple people wearing face shields. Is that something that works, or is that something that you would suggest for people who don't want to wear masks?
And by a face shield, are you talking about the face shields that generally have kind of a band around the forehead and then come down as a plexiglass or plastic shield in front of them? Is that the kind that you're thinking of?
Yeah, I think I actually saw somebody in Schnucks wearing something like that with a big hat on.
So what that does, so a face shield protects you from an open cough or sneeze from somebody else, from getting blasted. So if you and I are together in a grocery store, let's say, and I haul off and just sneeze, I don't cover, I don't even try, and I've just blasted this thing out, right? And you're wearing a face shield, that would protect your eyes and mouth from the blast, the actual particles of liquid that are coming out. But if you stay in that airspace, the next breath in that you take, it doesn't do anything for your breathing and protection from breathing the virus in to your nose and mouth. So if you didn't move away from me at that point, you would still suck in the virus that I had blasted out, and you still would become infected in that manner. So face shields really have limited use. So again, as a healthcare company, we only use them in situations where people are directly face-to-face with patients who are actively sick, or situations in which there's a lot of body fluids, like an OR situation or something like that, where we're protecting somebody from the splash. But we still, if you look at those folks, they still have masks on, because it's the mask that protects their mouth, nose, and lungs from inhaling the virus. So hopefully that makes sense. But so somebody's, for instance, just sitting in common workspace wearing a face shield, but they're keeping their 6 feet distance, does almost no good.
Well, for any of those remaining questions, I know we're coming closer to closing time. We can follow up with an email. So Tabitha, I'll pass it off to you.
All right. Well, thank you to all of our panelists. We really appreciate your time today. Please join us on Tuesday, June 16th for a COVID briefing, and then on Friday, June 26th, to hear from Maxine Clark, founder of Build-A-Bear. A big thank you to our sponsors, Technology Partners, and Kitty Academy. And for all the latest news and updates, please visit the St. Louis Regional Chamber's website. Thank you, everyone. Have a great day and be well.
Thank you.